Welcome to the Risetime Fax Management for SharePoint demo. Let's get started by looking at the processor view. In these views, we can see that these are the faxes that have come in and that need to be worked. At the top, we have a new order view in which all of the new faxes that come in are placed. As they come in, we look to see which phone line they were sent to, whether it was a stat order or a regular order, and assign a priority of stat if it comes in on that particular line. Also, we look at what fax number it was sent from, and based on a SharePoint list that contains the phone number and a physician name and physician group, we can assign it that data if we find a match. So as you can see, for this particular phone number, we found that it was from Dr. Nick Kramer from the Illinois Bone and Joint Institute. Underneath this particular view, we have the in-process view and the pending orders view. And these two views are for whenever orders have been worked, but perhaps they need more information. So in-process means that the order is going to go through, but we're waiting on some type of information, such as waiting for a call from a physician to find out more information. And you can see that over here in the right-hand column underneath the order comments, where all of the notes are put in so we can tell what is going on with that order. Underneath that are pending orders, and these are orders that we're not sure may or may not go through, but we want to be able to keep track of them in case they do. And as you can see in this particular example, there are orders that are not legible or the patient hasn't scheduled, and we can keep track of them without having to have them in the new order view. So let's go up to the top here and take a look at some of the tools we provided as new orders are come in. The first thing I want to show you is our image validation, and this is mainly for multiple page faxes sent in by the physicians that are different patients and that we need to divide them out into separate images. So the first thing we can do is see that there's a fax cover sheet that we don't need. So we can click the X button here, it will gray it out, and now this will not be included in any fax, it will simply be removed. Over here, we can see that this image is upside down. We click the rotate button and it's right side up. Now, if we need to investigate the order a little bit closer, we can simply click on it and it brings up a zoom, and we can just drag it around the order to be able to see details at a glance. Now, in order to split the image into separate faxes, we use the little drop down here that contains the number of pages that are in the fax. So we can see there were 3 pages, and we know that the first one we're deleting. So we assign this as number 1, and that will be 1 fax. And then we scroll down to the second image, and we assign that number 2. And when we click the submit button behind the scenes, that first cover sheet page will be deleted, and the 2 additional pages will be separated into 2 new faxes. And as you can see right here, we can tell immediately that these are the split faxes because we can see the original order number followed by an underscore and 1 and an underscore and 2. Next, I'm going to show you how we can enter data for an order. And we'll go straight into the edit properties. And from here, we have our data fields on the left and our view of the fax image on the right. Let's take a look at the fax image first of all. If we scroll down, we can see at the bottom that there are multiple pages to this, and we simply click on them to switch to the various pages. Let's start with page number 4. And we also provided some tools on this in order to make things a little easier. We have a rotate button, we have a zoom in button, and you can also drag it to the particular area that you'd like to zoom in on. We have a zoom out button, and you can also drag that. And then we have a return to original size. Now let's assign some data to this order so that we can provide that. And the patient date of birth, what department it belongs to, what kind of, and what date of the procedure. Now, We can also make copies of a particular order so that if on an order there were 4 different departments affected, let's say they need to have an MRI, a mammogram, and some blood work done, we can create copies of one order and make them copies of those so that we can assign what department they belong to and all of that information. And when we create those copies, we carry over some information about the patient so there's no double entry. And those fields are the patient name, the date of birth, the physician name, and the physician group, and the order date, because those are all going to be consistent for the same patient. So down here, we know we need to make, let's make 3 copies of this. We click the OK button, and behind the scenes, the system is going to create 3 different images of this and also keep the original. Okay, so now we can see that we have 3 new faxes, and we can tell they're copies because they have an _C next to them, 2 and 3. If we open one of these up in the Edit Properties again, we can see that the order date is populated, the patient name, the date of birth, the physician name, and the physician group are all populated already for us. One more feature of the new order view is that we can send faxes directly from here back to the physician. So if we clicked on the Send Fax option, we can enter a person to send the fax to, a valid fax number, and notes. And these notes will be placed on a cover sheet attached to the fax document underneath it. And this will be sent directly to the provider in the fax number provided. And once we click the Send button, it will go directly to the fax server and send the fax out. Now, let's go to the search orders. And from this view, you can see that we have the built-in advanced search for SharePoint with some customizations, particularly for this solution. Let's go ahead and do some searches here to give you an example. And we'll start with patient name, contains, and one of our patient's last name. We click the search button, and we'll see at the bottom of the screen all of the search results where the patient name contains written. Another customization that we made was to provide some data that will let you know why your search results were returned. As you can see here, these are metadata fields from the data entry screen, and it quickly and easily lets you know why your selections were provided. We can also click the Edit Properties button and go straight into an order and see the data that's been assigned to it and the fax image. Now let's go into the department view. And this view is for the various departments in the hospital, and we can restrict the view so each department can only see their orders. As you can see, we provided the advanced search screen at the top so that anyone in the department can be able to easily search for information if they have the patient's last name or the account number or any of those data properties. At the bottom, we provided the different views of the orders rolled up, and all they need to do is click on the header here, and they can easily see all of the orders contained in that view. The next tab is the order monitoring view, and this is for your department managers or the pre-service manager to be able to have a quick view into what is going on with the orders. As you can see at the top, we have today's orders, and if we click on the heading there, we can easily see that these are the ones that are sitting in the new queue. Underneath that, we have all orders by priority and status. Then we have orders from the past 7 days and from the last 30 days. And these are highly customizable. We could do orders from the past 72 hours, from the past 24 hours, so that your managers know exactly what's going on with the system.